Governor Abbott joins us now live from Austin. Governor, thank you so much for taking some time to talk with us this afternoon. You've heard the news that we've just shown our viewers. Fort Bend County is urging a shutdown. Harris County urging a shutdown. Mayor Turner urging a shutdown. Dr. Pearce, our health authority, saying it would be irresponsible to put kids back in school without a shutdown if the virus doesn't change. So address their concerns right now. Is it time to give them the authority to close the economy down?
So go back to what Dr. Pearce said, and what he talked about, the last part of his comment was it is essential for everybody to adopt these best practices right now. The best practices that he's talking about are the practices of everybody wearing a face mask or a face guard of some sort whenever they go into the public. Understand this very important fact, especially for your audience, and that is if we were to shut down for 2 weeks, as some people are asking, once we open back up, you would then see things begin to spread again. That's exactly what they've seen in California, what they've seen in Louisiana, what they're seeing in Illinois, what they're seeing in other countries. And that is, until there are medications to slow the spread of the coronavirus, there's only one thing that can slow the spread. And that is by people adopting the use of wearing a face guard of some sort whenever they go out. Let me explain it to you the way the doctors explain it to me. And that is, there will come a day when we do get immunizations where you do go into public. COVID will still exist. It's just that it will not be able to infect your body because of the immunization. The same thing will occur if you go out with a face guard right now. You can go into to the public. Somebody in the public is going to have COVID, but you will be, in essence, immunized from it by wearing that face guard.
Yeah, but I just want to push back. 4 days ago in a similar interview, you said if COVID cases, hospitalizations, and fatalities rise, it would lead to what you called the ultimate solution, a shutdown. People are wearing their masks at times, but all of those numbers, sir, are still rising. Can you ever see a situation in Texas where you would order a shutdown?
Sure. Ted, understand this. You said 4 days ago. Remember this very important fact, and that is it takes 2 to 3 weeks to see the results of these orders that have been put in place. As was mentioned, before the face mask order went into effect, there was also the order about shutting down bars. That has an enormous positive effect because we know that bars were areas in Houston and elsewhere where they were situations that led to the transmission of COVID-19. These two practices together, shutting down bars and people increasingly adopting the practice of wearing a face mask, these are best practices that will allow us to reduce the spread of the coronavirus.
And I think we all hope that works, and certainly the leaders here do. I want to ask you about schools, because we continue to hear from parents and teachers and superintendents about some concerns about schools. Take a look at these numbers when you closed schools on April 17th. The positivity rate was 6 points lower than it is now. The average daily cases were a fraction of what they were, and average daily deaths were half of what they are today. You said it was unsafe then to have kids in school. What's changed that now it makes sense to reopen schools across Texas?
Well, you need to understand what the strategy is about the way that schools would open up. Because the two key focal points as schools open up are, first and foremost, the health and safety of the students, the teachers, the staff, as well as the parents. And then the second thing is flexibility. And so what this means is this, and that is each school district has the authority to decide when they will open up schools for that particular school year. Each school district has the authority to determine whether or not, when they open up, are they going to open up with students in classrooms, or are they going to open up with online learning only? I saw a story just moments ago in a Houston news program talking about Fort Bend County opening up their schools only online. You saw the teachers praise it, and you saw the parents condemn it. Parents are very interested in having the children go to in-classroom school because parents know what pediatricians know, and that is the best setting for a child to actually learn is in a classroom with a teacher, with fellow students. So we're trying to create safe settings for students, for teachers, but if that setting cannot be established, to ensure that online learning, effective online learning, will be in effect for students as schools begin to open.
And we hope it is a safe place, but is there anything that's changed with the virus since April that makes it a safer school environment?
Nothing has changed with regard to the virus. What has changed are practices adopted by schools. the safety standards that schools are aware of today, that they can implement, are far superior to where they were when they had to close schools down. Everybody knows standards. Here's an easy one, and that is face masks are going to be required for teachers and students. Distancing strategies will be in place. People will not be entering and leaving at the same time. There are flexible schedules that superintendents would be able to adopt. All different kinds of strategies like that that will make the school setting far more safer if that is the pathway that the school district decides to go down.
Now, you've mentioned the pushing back the start date, which I think is an important thing to point out. Parents should know that superintendents can push their start date back as far as they think it needs to be. But will you allow superintendents to go further than those 3 weeks for all virtual learning? Can you tell superintendents tonight that if the need arises, they can do 100% virtual learning for longer than that 3-week window?
So I think that superintendents can expect to hear something along those lines from Commissioner Mike Morath here in the next few days. I think Mike Morath, the Commissioner for Education, is expected to announce a longer period of time for online learning at the beginning of the school year. Up to the flexibility at the local level. This is going to have to be a local level decision, but there will be great latitude and flexibility provided at the local level.
We'll stay tuned to Commissioner Morath's announcement, but I think you just made it, and I think that is certainly welcome news for a lot of superintendents in the Houston area. Finally, sir, on testing. As you know, it continues to be a huge problem across Texas. Our testing numbers, we're able to test a lot of people, but those results are taking way too long. How frustrated are you that these results are taking too long, and what can you do to speed it up?
So importantly, obviously, to the extent that tests take a long time to get the results back, that is frustrating. However, only those that are coming from Quest Diagnostics as well as another 1 or 2 private labs, that's where the slowness is. We are enhancing state-based labs and getting a very quick turnaround, typically 24 to 48 hour turnaround. When we are using state-based labs, we are increasingly able to do that.
When can we expect that to be more widely used, though?
As we speak.
Okay.
It increases by the day. Remember this, and that is we've gone from testing 20 to 25,000 people a day to averaging well over 50 or 55,000 people a day, and we're able to turn around most of those tests in a 24 to 48 hour time period.
Governor Abbott, always a pleasure to talk to you. I hope you'll join us again soon. Good luck, sir.
Count on it. Y'all be safe.